We have our dear friend and former faculty member here at VCU, Dr. Spencer Harpe. He is a professor of pharmacy administration at Midwestern University College of Pharmacy in Illinois. His scholarly interests include outcomes research, healthcare quality, educational research, and meta research. He has a keen interest in improving research and evaluation capacity among pharmacists and working to elevate the quality of the pharmacy services literature. He's currently Deputy Director of JAPHA, the Journal of the American Pharmacists Association, and has served on editorial boards of several other pharmacy-related journals. Dr. Harpe is involved in numerous professional organizations, including AACP, APHA, AEREA, and the American Evaluation Association. So without further ado, I would like to turn it over to Dr. Harpe and thank him for being willing to present in our seminar series.
Well, thank you, Teresa, for the invite. I know this goes way back to, March this past year over an adult beverage at APHA. So it's good to be here. Good to see some familiar names and faces as we go through this. So, and I'll apologize for my voice. I've been doing leaves this morning before this. So, it's that time of year and it's going to rain tomorrow. So they got to get out. So, I had grand plans for this to be fully finished, but as we all know, life happens. So I'll present where we are in this project, give you some of the preliminary findings, and then you'll probably have some time to discuss, your thoughts on this, because I'm sure this is a topic that's near and dear to many of your hearts. So let's go ahead and start. Like I said, we're going to be looking at the sustainability of pharmacist patient care services, and I'll go ahead and put in the back of your head right now. Think broad about what that means, pharmacist patient care services, in terms of who's providing it and things like that. And if you do have questions, I have the chat up so I can monitor that. So please feel free to interact there if you feel so moved. First, I want to do shout out to my collaborators, Dr. Wendy Mobley-Buckstein, who's a professor at Drake, and then Bella Smith, one of her students. She's a final year pharmacy student at Drake. And then two of my students, Midwestern, Joanna Cho and Cindy Quach, who are second years. I'm sorry, since we moved to a three-year program, I'm trying to do this cross-walking of what is third, what is final year, all this kind of stuff. So in terms of collaborators, that's who I'm working with, and there's one person who didn't make the slide because I forgot. Andrew Gentles, he is a uniformed officer in the Public Health Corps. He works at CDC. And he and Wendy and I were in early stages in conceptualizing this, but because of other work duties, he had to take a step back. So, but I still wanted to acknowledge him for that. So objectives, like I said, we're going to talk a little bit about sustainability, what it is, go a little bit of literature reviews and developments related to sustainability, especially conceptualization, and then jump into the scope of review protocol that we developed, that we've started, and then give you just a little taste of the preliminary results of where we are. So first, some background. So this is not surprising or foreign to any of you who are in the room or online, but pharmacists, pharmacies develop new services all the time. There was some need that was identified to meet patient or population needs, and the pharmacists or people they're working with said, we can do a better job. So let's develop something new to speak to and help these people that we're working with. Those of you who are working with pharmacy residents, that's a key part of residency programs, to varying degrees and to varying words, excuse me, and the accreditation guidelines and those expectations for residents, what they're doing in the residency year. We see this more frequently on the community side, but this does happen inpatient also. Faculty do this all the time, whether you're, a new faculty position, you have a new practice site option, or changing practice sites, and you have to develop a new service to fit in or to integrate yourself into that new practice setting. There's always concerns over financial viability of these nurse services. Nobody's shocked when I say this, but pharmacists are not cheap, even though we know we do good stuff and we can avoid unnecessary costs, but at the end of the day, we're expensive. And then thinking about what those potential services could look like, there's some logistical things, workload issues, employee well-being, for those of you who've been at APHA and House of Delegates, there seems to be year after year something that comes up about this is just another unfunded mandate, things that we want pharmacists to do, but we're not paying for it. So what does that do to workload? So, obviously that touches on some quintuple aim issues in terms of well-being and how that can affect mental health of the employees themselves and the healthcare professionals. So I'm going to jump right in with some audience participation. When I say sustainability, what comes to mind first? And feel free to shout it out or put it in the chat. I'm seeing mostly B's, excuse me, a few B's. I got Bentley being ornery with a C there. So, yeah, you can see it's kind of all over the place, but most of you are in the kind of first three, A, B, and C. So obviously, in the current, state of the world, environmental sustainability comes to mind for a lot of people. Yes. Um, when we first started this project, that was one of the things we grappled with is how do we frame this so that it's clear what we're talking about. When we weren't completely clear what we were talking about. So there's a lot of head scratching and, kind of clarification on our part. But, high level, what brought me to this was more the economic and kind of process sustainability piece. And again, that was kind of a trick question. None of those are right or wrong. It's great and all of the above. So now I want to take a little left turn and talk about what's been going on in the literature a little bit. So what's in a name? When we say sustainability, there have been over the past 5 to 10 years, I'll say rich, some interesting discussions in the literature out of some pockets of researchers around the world to look at, both service development and implementation, and also this idea of sustainability or sustainment. So Crossbow Gonzalez and her group, they published kind of a narrative review, and they were kind of proposing a definition to start debate among us researchers and practitioners in the literature. And so in their work, they came up with these, in their review, sorry, they came up with these 5 common terms that they saw in the literature. So when you think sustainability, there were things like routinization. So the thing that was being implemented became routine or standard practice. Institutionalization. So it moved from that new thing in that corner of the organization to being, the organization drank the Kool-Aid and was all on board. Continuance. I think that kind of makes sense that you're continuing to do the thing that you tried. Durability, which I think is a really interesting term because it kind of speaks to that no matter what changes or happens, the service, the thing that you're doing sticks around. It's durable to different settings and whatnot. And then this last one, which also resonates with me, maintenance. So you've started this new thing, you've gotten it up and running. How do you keep it up and running, right? Like your car or your house. Got a new car, great. The new and shiny wears off, but you still got to work with it. So what are you doing to keep that car running smoothly? So what are you doing to keep that service running smoothly so that it's kind of self-sustaining? So those are some of the terms that they found in their review. And this was the kind of semi-spicy, thought-provoking definition that they proposed in their in this paper of theirs. So they framed it as sustainability is a phase in the process of professional pharmacy service in which the service previously integrated into practice during the implementation phase is routinized, institutionalized over time to achieve and sustain the expected service outcomes. Lots of words, I know. But I think when I found this, I kind of had my own aha moment. We shared it with the team. This is where we were going, right? You tried something new. You think that it's doing good things, or you've seen that it's done good things. How do we make it keep doing good things? So embedded in this definition, you can see that sustainability is a phase on its own. It's not some one thing that happens once. There's work there after implementation. So you've gotten over the hump of doing the new thing, but now what next? But with a focus on continued update, buy-in from the organization and institution to achieve and sustain those expected service outcomes. So there is an expectation of what you're trying to achieve. So all that wrapped together. And I was very thankful that Carmen and her group proposed this definition because it kind of helped me go, okay, so from those previous kind of 5 things I showed you and these here, it's like, well, where are we going? And this really helps. So some more developments from the literature. This second bullet point, that was where that definition came from. There's a few others from SACDev and Kastner and Merck that I'll present in a bit. And then Joanna Moulin out of Australia has done some work in this too that I'll present a little bit for. So SACDev, she produced, this is coming from business sustainability and AGHP, but talking about, new pharmacy services in the hospital setting. What are the 4 things needed to achieve? And she flat out laid it out as business sustainability. So you need leadership, both within the group that's implementing the service, staffing to provide the service, IT to coordinate and make the service easier, and then compensation. And I think what's interesting is we all seem to focus on the compensation part, but sometimes we don't tend as much as we could to those other 3 things. So Kastner and Merck talked about, this was specifically in the AmCare setting, and they were looking at comprehensive medication management services or practices, sorry. So when they did their, this was a commentary, and did their kind of head thinking and head scratching and navel staring, they came up with 2 big buckets. So there's fiscal strategies, so optimizing billing, reducing the total cost of care, and then some quality-based strategies. And on the quality side, these are all things that we know about, nothing new. From Kastner and Merck, it was more of a kind of presenting it to, here are these 2 big buckets you need to think about. Again, nothing ground shaking here. I call your attention to the previous 2 slides, timing there, 2017, 2018. Okay. So fast forward 2021, Crespo Gonzalez and her group again did some interview work about what is needed to sustain work in the community pharmacy setting. And through their interviews, they came up with these 4 big buckets: social performance, so people, staff, and patients; environmental performance, so policies, recognition, economic support; economic performance, that was called out separately here, so payment, partners, the actual economic benefit, and then the service itself. How are they evaluating the service? How are you adapting the service? The resources needed to provide that service. So in terms of this compared to the other 2, notice how we're getting a little more focused and thinking about what are the things you need to tend to promote sustainability. So again, 2021, so we're seeing some kind of things percolating on the literature about what do we mean by sustainability in the context of pharmacy services. And then the last one that I'll present in terms of this kind of literature, what's going on out there. Another one from Owen and her group. This is part of her dissertation work. So her really interests her, the thing that excites her, if you look at her work, is how to develop, implement pharmacy services, to look at, new frameworks for that, to help use it, to systematize it, things like that. So in one of her papers, she and her group, her research team proposed a framework for the implementation of services in pharmacy. And that's what this big picture is. So for those of you who are familiar with EPIS from implementation science, there's kind of a flavor of this here. So once you have this new thing you want to try, you're exploring the situation, preparing to implement it, testing it out. Again, she's made some kind of tweaks here, and then implementing it full force. And then this kind of offshoot is sustainability. So how do you maintain it? So again, notice how sustainability is a separate piece here. And if you're wondering, well, why is this kind of light or grayed out? Well, if you're doing something and you can't sustain it and the service needs to be adaptable, then you have to go back to start the cycle over. But again, notice how sustainability is called out on its own here. So putting it into the larger framework for implementation, service development. So again, that's the brief review of where we've gone over time. And in terms of timing, notice this is 2016, 17 up through 2021. So kind of tight 5-year period that was about 5 years ago. So this isn't really old. It's still new-ish. Um, and that was kind of where I started to go through in terms of thinking about, well, should we look at this? But why? And you're probably asking, Spencer, why? Why do you even care about this? So over my career, I've been in a position to help people, whether that's developing and implementing pharmacy services, whether working with residents or faculty members, or when I was in grad school and hospital pharmacist, there were things we did there, and I helped out with in the evaluation of pharmacy services. I've seen a lot of this as a journal editor and reviewer. Um, at JAPA, we try to nudge people when they're submitting papers about some new pharmacy services they're implementing. On the evaluation piece, is there something that you can say about, is this financially viable? Can you speak to that? Or if you're not there yet, say it. Because we want that as journal editors and as readers. Many of you want to know that when you're reading about these new services that they're sometimes fantastic. Worked with pharmacy residents, many pharmacy residents over time, both hospital and community. And then discussions that I've seen and had at pharmacy organizational meetings, both attending conferences, sidebar conversations, discussions, in leadership positions and things like that. So there was a part of me that over time that's been kind of more and more, what's going on here? Why are we not moving forward? So I want to present this a different way. So think about this as the journey of a service in a residency. So the residency starts, got that resident excited, ready to go, beginning the residency year. They either have this new idea for service or one was given to them and they're like, ooh, this is great. Great idea, ready to go. Let's do it. So they jump in, they implement the service. Things look great. Patients are happy. Outcomes seem to be improving. All things look great. And then what happens? The resident leaves. Well, what happens to the service? And all too often we see this. That service, if we take this plant metaphor, when the resident goes, all too often there's no framework set up, no system set up to continue that service going. Now, sometimes this is an okay thing, right? Like maybe somewhere during the middle part, it's like, this was great, but there's just not enough for us to do this. Let's call it a day, right? In the words of Kenny Rogers, you got to know when to hold them, know when to fold them. So sometimes this is an intended consequence, and that's okay. My concern, and this is what I've seen as an editor, as working with residents and talking to others in pharmacy practice, is when this was not the intended consequence. This was not the intended outcome. This happened just because there was nobody there to see it through. So again, that was kind of another thing that was like, maybe we should look at this. So jump into the methods here, and this is where I'll start to talk about the scoping review protocol and get into where we are in the process. So we're doing a scoping review. We're following the recommendations of the Joint and Briggs Institute and using Prisma scoping review criteria. So pretty standard stuff. Trying to do best practices and following, I teach students stuff in class. I should do the same thing when I'm implementing it. So if you're asking, well, why scoping review versus something else? And I'm not saying this to question any of your intelligence. I just, having seen this on the reviewer side, people think they know what scoping reviews are, but it's always good to be on the same page. So here are two definitions for when scoping reviews are good for or particularly helpful as an evidence synthesis process. The first one's from Canada, pretty straightforward. The second one from Marcine O'Malley, who kind of were early adopters, but early figures in coming up with conceptual underpinnings of scoping reviews. And I really do like this definition here about why when to use a scoping review. So key concepts that underpin the field of research to clarify working definition and the conceptual boundaries. So, I'm viewing this, and as the research group, we talked about this, we're very much on this, what is the working definition of sustainability, how people are actually using it when they're publishing. So, when I get into the protocol here in a bit, keep that in the back of mind. We're trying to understand what's going on. No, we're not trying to come up with, here is the one framework for sustainability. Here's the best definition. This is trying to look at what people are using, if they're using them, and things like that. So just for those of you who aren't familiar, there is a long and winding road for scoping reviews. First you have to define and align your objectives. Then think about inclusion-exclusion criteria and how that relates to the objectives and questions. Planning your approach, searching for the evidence, selecting the evidence, extracting it, and then analyzing presentation and then summarizing it. So again, nothing too strange here. If you're familiar with systematic reviews, most of the same here. It's just what you're doing at the end. So that brings us to our review questions. So the primary question is, how is sustainability of pharmacist-provided patient care services in outpatient settings within the USA addressed in the literature? And then a secondary question, are there any differences in whether and how sustainability is addressed, thinking about different study characteristics, whether that's journal, whether that's, is it a resident project, is it not, who are the authors, is this primarily showing in the pharmacy literature versus the services literature, was it funded, things like that. So there's some things about the review questions that I do want to pull out before we go on. So yes, we're focusing on the US, on that in a second. And then, like I said earlier, terminology, I know, that it matters here when we think about pharmacy patient care services. I know when I started out, I said pharmacy patient care services, and here I'm saying pharmacist provided. Some of you are already going, wait. Give me a second, we'll get there. Okay, another audience question. This is some foreshadowing to see where we are. So what framework is commonly used to guide scoping reviews? And your options are A, PICO, B, PCC, C, EPIS, and then D, Squire. So put that in the chat if you have thoughts. Thank you for your honesty, Casey. So we'll go. So there are various frameworks. These first two are ones that you may see in scoping reviews. PICO or PCOTS, depending on how you learned it or which version you learned. That's the population or the problem, intervention, comparison, and setting, and then the TMS is the time, and then the S is the setting. Outcome is time frame and setting. That's particularly good for systematic reviews. Depending on how broad your scoping review is, PICO may not be helpful because you may be focusing on an intervention or on an intervention maybe more broad. And that's where the PCC framework comes in, and that's the population concept context idea. That's what the Joanna-Briggs Institute recommends for the guiding frameworks for scoping reviews. So again, the previous question was kind of a two for A or B would have been okay. SPICE and SPIDER, those are just different ways to think about evidence synthesis and evidence extraction. Those last two fit with other types of reviews, less so scoping. So PICO or PCC are primarily the ones we see used for scoping reviews, depending on, again, how broad and narrow your review may be. So that brings us to the project we're working on now. So we've used the PCC framework. So first is participants and population. So we frame this as pharmacists or pharmacy personnel. Those are the service providers. And patients and caregivers, those are the service users. Because if you remember, we were focusing on, remember, I haven't told you yet, we're focusing on the outpatient setting. So since it's the outpatient and we're looking at pharmacist patient care services, that's why we wanted to get all of this patient and caregivers into the participants in the population. So service providers and service users, those two. And if you're concerned about this pharmacy personnel, as we started getting into framing out the project, we had some questions about, is this just pharmacist the pharmacist providing services. We've seen lots be done with pharmacy technicians, advanced care technicians. Should that be subsumed or counted as part of that, since technically technicians have to be supervised by pharmacists? So we've kind of taken this as sort of broad now. We're leaving it as pharmacist or pharmacy personnel. So if we see something where tech is doing something, um, we're still considering it relevant. So the concept, that is probably the only thing that's straightforward here. Sustainability of the patient care services, because that's what we're focusing on. And in the context, outpatient settings in the US. So we'll start kind of at the end and work our way backwards. So why the US? Well, as we all know, there are some, say, delicately unique organizational and financing characteristics that we have. And although maybe there have been some great, services developed and implemented in Canada or Australia, UK, other parts of the world, picking those up and dropping in the US may not work for a lot of reasons. So we try to keep this framed in the US. And then the outpatient setting, the reason we're focusing on outpatient, originally thought community only, but as we were thinking about what the patient care services looked like, we were concerned that community setting would be too narrow. So we didn't want it to be outpatient settings. So the two that you're probably thinking about first is community, great. And then the other one, in-care pharmacy. So think, the in-care clinic. In-care clinics where pharmacists work, across the street next to the hospital, in the outpatient building. Some of the good things that Kelly and them are doing out at Daily Planet, pharmacists in outpatient settings, or pharmacists embedded in a freestanding medical practice. This could even be an outpatient pharmacy within a hospital. But what we don't want are those inpatient things. What we don't want are institutional things, so long-term care, rehab, things like that. We did clarify early on that if it was like home care, so like pharmacist home consults, that's outpatient, right? Because you're not institutionalized, with the exception of hospital at home, which is a different framework altogether. So we're focusing on services provided to patients or caregivers by the pharmacist or pharmacy personnel. The concept we care about here is sustainability of those services in the context outpatient cast fairly broadly in the USA. So keep that in the back of your mind as we start to go through the search strategy with you. So for the search strategy, I've broken this down into what, where, and how, or when. So what we're looking for. And I've tried to give you a flavor of the actual terms we're using here. So there's the pharmacy services. So pharmacist care, pharmaceutical care, pharmacy service, pharmaceutical services, pharmacy clinical services, the alphabet soup that is the different versions of NTM, CMM, COMM, all that kind of stuff. And if you're looking at this last one and go, well, Spencer, why didn't that get caught by some of these up here? If I knew, I would tell you. But as you all have probably seen when you're doing these literature searches, sometimes the search guides are not in your favor and there are gremlins in the machine. So we added this in to kind of catch any that weren't there. We also wanted to keep the focus of the article on development, implementation, and evaluation. And again, if you're asking, well, why didn't you include sustainability? We tried. That made things fall apart. So we stepped back and just focused on these three as the focus of the article. So pharmacy services and various things, and the article focus. Now, as you can imagine, trying to filter out inpatient hospital institutional at this stage was exceedingly difficult. So here it was just kind of wherever it's happening, we would sort it out later. So that's what we're looking for. Where did we look for those terms? Title, abstract, keyword. Again, nothing too hopefully groundbreaking or concerning there. And then when were we searching? So we were looking for a final publication date between 2018 and 2024. So if you asked why 2018, so going back to those recent literature developments, some of those, like the Crespo-Gonzalez paper that kind of presented that definition for debate in the literature, that was 2017. Some of the Moulin stuff before 2016. So as we discuss this, it's kind of like, well, if that's the kind of starting point, an index date, if you will, what would be a sufficient time to allow this to kind of take hold in the literature? And he said, let's we don't want to start it too soon. So let's give it 2018 and just start from there. In terms of why stopping at 2024, you got to stop somewhere. And we had been working on this, through 2023 and 2024. So we put all the journals and last issues of 2024 as the final publication date. And I will say this is final publication. So even if something was early ahead of print with full text, if it wasn't the version of record, we didn't include it. So again, search strategy. So what did we search? We searched 5 databases, Academic Search Complete, Nursing through CINAHL, IPA, which every day I go into IPA, I wonder why we still use it, PubMed, and Web of Science. Now, if you're wondering why I didn't use Embase or Scopus, we considered including those early on. Scopus is its own behemoth. EBSCO, we had talked about it, but trying to, and we did some of the test searches on it, but it wasn't giving us anything beyond what we were already finding in these 5. And then the kind of logistical challenges of trying to merge those in with some data oddities, we decided to keep it to these 5. And again, if you remember, from a scoping review, the goal is not to catch every single paper out there. You want to get enough that you can see what you're going on and answer your question. So we were comfortable with these. And then there were a handful that we wanted to search manually. JAFA has a new family of open access journals. Practice Innovations is one of those that didn't, or when we were doing the searches, weren't in these databases yet. Innovations in Pharmacy, the journal out of Minnesota. Again, it wasn't showing up consistently in some of these. So it's in PubMed Central, but not PubMed at one point. And then the NDPI journal Pharmacy, again, those last 2 were showing up in bits and pieces, but we decided to search those manually because we identified those as important. So what about medical journals? Yes, the pharmacy journals, those are the only ones we hand searched. But on the left side for the databases and the platforms, that include anything in those indices and those databases. So, JAMA New England, those are all already showing up. We didn't specifically hand search additional medical journals because it seemed like it wasn't going to give us the bang for the buck. So that's why we hand search, because if you've done these, hand searching is painful. So we only hand search the extra pharmacy ones that weren't captured elsewhere. Hope that helps, Cindy. If there's one that you're thinking about that's not on here, JACCP, thankfully, through the process of this, it actually got added to some of the databases, so it was already there. Didn't have to do any searching. So those are the search strategies. And now I'll walk you through our inclusion-exclusion criteria. So again, inclusion, pretty straightforward. Pharmacists provided patient care activities, pharmacy personnel too, in the outpatient setting. And then you can see all the exclusions here. Because this is important in a bit. There were some things, these 5 that I've highlighted here in the broken line, those were things that were extracted or excluded in the kind of first round of screening that I did. So I pulled those out, and then the rest of the exclusion criteria was the whole group looked at. So record management, I use Otero to manage the initial screening and to do deduplication. And as you can imagine, when I get to the results portion later, deduping manually is not something you want to do, so you need help with that. And then we use Covenants for full text review and final eligibility, and then data extraction and verification. So the screening that I talked about, we used a 2-round screening process. So the first round, one reviewer, me, reviewed all the initial records for relevance. That was those first level exclusions here in the dashed line. And then if I was unclear, I went to Wendy and we kind of hashed things out. And if we were still unclear, went to a third. Again, pretty standard stuff. Second round review. So this is things that are not initially excludable based on, it was a review, commentary, something outside the US, things like that, education. That's where I went to the second round review, where it was the typical double 2-person review of all those. So 2 people review them independently. If there was lack of agreement, mainly for the include versus exclude, there was a third reviewer called in. If there's continued lack of agreement, we discussed. And then if there was lack of agreement on why the exclusion happened, Because if you think about your Prisma flow chart, you do want to know why things were excluded. We did discuss there to kind of, if I said it was excluded because of this reason and you said that, great, we're on the same page for exclusion, but let's chat about why and come to agreement. So that was the 2-round screening process. And I can tell you we're still working on largely coming up to the end of round 2. Now we can talk about some results, and keep in mind, this is very much in progress. So this is where we are right now. So the searches are done. Initial screenings, that round 1 screening, that's done. Full text review for inclusion and process, and then we've started with some data extraction processes. More on that in a bit. So where are we? You can see the numbers that were received here, anywhere from about 2,200 to almost 5,000 from the different databases. Then we found another 79 articles through the manual searching. After the deduplication, we removed 8,600. Part of that was through Zotero, and I did manually verify it, so it wasn't like I just trusted Zotero, but actually went through and looked at it. And then there were 3 retractions that were in the literature that we went ahead and removed at this stage. So that left us with just under 8,600 that were screened. So you can see here I pulled out why they were removed during screening. Review articles we kicked out. We excluded COVID-19 because, yes, we all still have emotional baggage from COVID-19. And yes, there are things that we can learn for the future from COVID-19, but most of those services were not developed with long-term sustainability in mind. So we kicked those out. Newsletters, lane magazines, so Pharmacy Today, Pharmacy Times, like that, conference proceedings, non-US papers, anything that was focused on education or training, of a student or like continuing professional development, those went out. There were some where, even though you saw those terms I had, pharmacy wasn't included, like medication management. It was all about psychiatric nursing. That cut off. There are a handful of other ones. These are like opinion articles, things like that. So we pulled just over 2,000 for full text review. 2 of those could not find. That sent me down this weird infinite do-loop rabbit hole of pulled up the paper, the title was right, the abstract was wrong, tried to find the new one, that was wrong. So if I find those, I will include them. But as of right now, they are ghost papers and we cannot find them. So we're here assessing the eligibility, looking at that there. You can see all the articles, the journals we found here. You can see the top 5. Shouldn't be that surprising to you. These are the top 5 offenders here. So extraction, where we are. Extraction is tricky, as you can imagine. The good thing or the bad thing is that scope reviews do give you some room for iteration and flexibility in extraction. And the challenge here is you think you know until you don't know when you get into the extraction process. So I'm going to show you the first 10 studies. I had hoped to have 50 studies because we have those ready, but as I was going through it, I was like, ooh, this is not unfolding the way we wanted to in terms of extraction and collection of data. So that's why I say it's tricky. But I'm going to stick with the first 10 just to give you a taste. So the first 10 studies. And I handpicked to do some from HHP and some from JAFA just because those would be kind of common journals we were all familiar with. We know what they publish. You can see the timeframes here. Who were the authors of those? You can see pharmacists were involved in all of them, researchers in most of them, and then some other types. So where was the setting? About a third was in community, and I'm listing this as community NOS because the way it was listed in the paper, you get a good feel for, is this a national chain? Is this a local chain? Is this mass merchandiser? Things like that. It just said, in a major community pharmacy in the area. What does that mean? So that's why I have an OS. Other common things that you would think: national chains, independent grocery stores, some hospital outpatients, care clinics affiliated with a hospital, and then one freestanding care clinic, which was basically a physician's office. So what were the study characteristics? You can see what the focus was. And this is how we're collecting what the focus is: development, feasibility, implementation, evaluation, or expansion. This is a later addition because as we were going through some of the papers, we saw that kind of start to trickle out, and it's like we should probably capture that. And if you're wondering, well, hey, Spencer, why do you have feasibility if you got that previously on the inclusion exclusion? We excluded pilot studies. Well, this is one thing I had a lot of discussion about early on was the service may have been fully developed and maybe it's moving to a new place, but you're trying to see, is it feasible to do this? Embedded in feasibility, we felt was a nugget of potential sustainability because if you say this isn't feasible, why is it not feasible? Maybe that's because it's not perceived to be sustainable. But we view that as categorically different than this is a pilot study. We're just trying to see if this thing will work at all, proof of concept, things like that. So those we went out, but if it was more than just a typical pilot and it was getting towards here's this kind of more developed thing for feasibility, we did include those. You can see the study designs there. So funding, about 70% mentioned funding in terms of where they were where their funding was from, places you would expect, a lot of NACDS, a lot of APHA, and then other funding, so CDC, ARC, things like that. In the bucket that we'd looked at so far, there was no NIH funding. I know there are some out there, but right now, in the future, there will be like an NIH funding line. Okay, so big drum roll. The part that you're all wondering about and the part that I was wondering about. What did we see about sustainability? So half of those 10 papers, 50%, mentioned sustainability, period, somewhere, anywhere in the paper. Of those five, so these are all, so 60%, that's three. So three papers mentioned in the abstract, two intro background, three in the methods, two of the results, and then three each discussion and conclusion. There was one paper that mentioned it in every single section. And part of that was a very robust implementation science paper study. So they were actually thinking about sustainability all throughout. In terms of people who provided a definition, only one. Was it evaluated explicitly? Only one. And these were not the same paper. Was it measured? I'm saying one. It's debatable how what you count for measurement there. So, like what they said was sustainability was evaluated as the income generated from the service and the cost offset, the potential cost reduction or cost offset for reduced admissions and reduced length of stay. That was like a transitions of care, outpatient medication management study. So yes, the pharmacist could bill for their services, but because it was tied to a health system, there's also that kind of typical thing of cost avoidance and reduced length of stay. But so that's how they took the measurement. So far, I haven't seen any of the formal like instruments that there are out there to measure sustainability and things like that. And then, from a framework perspective, we were trying to capture, are people using these frameworks? What are they? If they are, which ones? The only one that we saw mentioned was the EPIS framework, and that was that paper that mentioned it all the way through because, again, it was that very robust implementation science study. Okay, look at this. Now, there's only one correct answer. So what percentage of papers mention sustainability at all? 30, 50, 70, or 90? Yep, only half. Now, if you were to ask me, Spencer, do you think that's what you're expecting? I don't know. I try to go into this with an open mind just to see where the cards fall. Um, I'm not going to say I was turning cartwheels down the hall at 50%. I'm also not, curling up under the bed and going, life is horrible. Just going to try to see here. Second question, based on the results. So what framework was discussed in the context of sustainability in the papers? So basically, of the frameworks out there, which framework was used to discuss sustainability in those first 10? CFIR, Green, FISPH, or EPIS. And yeah, that one happy paper used EPIS. If you're wondering, do these other ones, these last three include sustainability or maintenance somewhere. CFIR doesn't really. There's debates about whether some of the pieces of CFR if they get to it, but B, C, and D call it explicitly that sustainability or maintenance. But in the 10 that we looked at for this first one, the only one mentioned was EPIS. Okay, so again, I wish I had more results to provide to you, but that's where we are. So I'll talk about some next steps. And again, this is as this has been rolling around in our heads, as we've been doing the reading and early reviews of this. So there's theoretically a conceptual difference between sustainability and sustainment. So think about sustainability as the process that you go about, the concept of it being continued or able to continue, versus sustainment is what you have to do to sustain. Okay. It's almost like when we talk about causality, there's causation and then there's a cause, right? Um, so also think about things that are coming to our head. Is there a difference between sustaining an intervention, like a very discrete thing, versus a service, which may have lots of distinct things and lots of moving parts? Other things that we've kind of come to realize that we need to call out moving forward. Sustainment is indeed an active phase. We think maintenance, oh, you're just kind of chucking along, you're happy, you're keeping on. That actually takes work. So that may be one of the things that we see, we're trying to dig into as we go through, and that may be a more a call out for future work when we write the final results up. What is the role of funding agencies? Could there be funding programs specifically for sustainability? Would that be part of the call for the funding proposals? That you have to speak to sustainability. How does accreditation or other regulations affect this? Like thinking about community pharmacy residency. You have to do this thing. Okay, check, you did the thing. But then what next? Right? So is that accreditation regulations hurting us? So that's all I have. Right now, I've got time for questions.